Hi everyone, this is Elizabeth Gola from Olivet Nazarene University. Today I'm going to be talking about project management, specifically the Surgical Care Improvement Project. So first off, I'm going to talk about the purpose of project management. So the purpose of project management is the use of a project manager in order to best attain positive end results regarding a certain topic. The use of a project manager is best because the skill sets a project manager has will bring the highest possibility of achieving the end goal. So the project managers are able to have the best skill set to bring to the table. So what I'm going to be discussing is the Surgical Care Improvement Project, also known as SCIP, and I'm going to be talking about the scope of the project, stakeholders, the time frame of completion, and financial considerations. So, the scope of the Surgical Care Improvement Project. So, every year there are multiple surgical errors that not only harm patients but also increase the number of days spent in hospitals. However, many of these errors are preventable if we were to properly use all of our resources and use the best evidence-based research in how to protect our patients from these errors. So the purpose for Surgical Care Improvement Project is to utilize all resources to reduce the number of surgical complications. This includes the prevention of surgical site infections, appropriate use of preoperative and postoperative antibiotics, maintenance of normal body temperature, venous thromboembolism prophylaxis, so your heparin shots, your compression stockings, and the SCDs that we use in the hospital, and avoidance of any adverse cardiac events, so making sure patients get their cardiac medications before surgery or post-operatively, sure that we do a medication reconciliation to make sure that these patients do get their cardiac medications within a realistic time frame after surgery and are not getting these medications for a couple of days or so. The stakeholders of this project, so this is going to be anyone working with the patient, so physicians, nurses, the patients themselves, because they're the ones that are suffering the consequences, hospitals, because they're going to either be getting, with the patients getting hospital-acquired infections, it's a possibility that the insurance companies then will not pay for these infections that they acquire, so the patient will be paying for them along with the hospital. So the time frame of this project, it's still continuing on. I think it's going to be something that will go on for a long time in the future because it has been found to be successful. And how it originated was in 2003, it was found that the Surgical Care Improvement Project was necessary to implement after finding that surgical complications accounted for 22% of deaths. So, and the campaign was initiated in 2005, and its first major goal was to decrease surgical complications by 25% by 2010. Clearly, it's 2014 now, and this project is still going on. And the Committee of 10 national organizations actually meet monthly to discuss new initiatives to implement to best help patients. So every month they'll come together and say, okay, what have we noticed going wrong this month, or what haven't hospitals or physicians or nurses been compliant with, and how can we change that? So lastly, some financial considerations that are taken into consideration are that due to the nature of the Surgical Care Improvement Project, hospitals have actually been given financial incentives to comply with this project. So hospitals that fail to report properly the use of SCIP will receive a 2% reduction in payment. So if they do not take out Foley catheters on time, if the patients are not getting their preoperative antibiotics, if they're not getting postoperative antibiotics, they're going to see a reduction in payment from insurance companies. And of all the hospitals, 97% have received full Medicare and Medicaid reimbursement, which is a positive correlation between this project and hospital utilization. And the best way to utilize systematic ways for project management could increment the quality of the project, save time, and eliminate costly mistakes by using a project manager, since they